Today's Pilates flow will help relieve any lower back pain you may be experiencing through your pregnancy. Although it is safe for every trimester, if you at any time feel a sudden shortness of breath, dizziness or pain anywhere, make sure you stop the exercises and book in with your healthcare provider. So coming onto your mat, whatever position is comfortable for you today, I'm going to sit up on my heels and we're just going to start off with some diaphragmatic breathing. So placing the hands underneath the belly button, cradling your belly, we're just going to take a breath in, feel the tummy expand, and then exhale, gently hug the baby towards the spine. So inhaling again, and then exhale. Now just thinking about that pelvic floor. So as we inhale, we feel the sit bones widen, pelvic floor relaxes, and then exhale, we feel that gentle lift up and in. One more breath here, growing nice and tall through the crown of the head. And then exhaling, gently hugging baby to spine. Inhale, let's reach those arms up long towards the ceiling, and then exhale, going to your right. Inhale, reach tall. Exhale, the left. Inhale back to center. We're gently going to cactus those arms, shine a light through your chest, gaze up. Inhale, reach up, and then one more time through to the right. Exhale. Inhale back to center, and then exhale to the left. Inhale back to center, and then one more cactus of the arms, gazing up, shining a light through the sternum. Inhale, reach tall, making your way down onto all fours. So wrists directly under shoulders, knees under hips, going into cat-cow. So we're going to inhale as we reach the crown, looking forward, and then exhale. We're going to inhale, shine a light through the sternum again, and then exhale, hugging baby to spine as we curl the spine. Inhale, lengthen, and then exhale, pressing the floor away, curling the spine. Inhale, lengthen, and then exhale. Very important here that we don't just sag into that lower back. So you still want it to be active as you gaze up, and then exhale. Last one here, inhale, lengthen, and then exhale, scooping up, hugging baby towards the spine. And then just gently reaching those arms long, coming into puppy pose. So you can go, I need to go a little bit wider with my knees just to make sure there's some space for my belly. And then just gently relaxing that head down, feeling the sit bones widen, feeling the pelvic floor relax and lengthen. Breathing into that pelvic bowl. And then exhale. 3 more breaths here. Last breath. Then we're just going to gently take that left arm, we're going to thread it underneath the right. Just working within your range, so I'm lightly pressing into the floor with the left back of the palm. And again, just breathing into that stretch, so I'm not forcing that rotation. Breathing into the left side body, feeling that stretch behind the shoulder blade. One more breath here. Gently unraveling, coming back to center. Now threading the right side through. And again, pressing the back of the right palm into the floor, breathing into the stretch. We're not forcing the stretch here. 2 more breaths here. Last one. And again, gently unraveling, making your way back to center. Again, coming up onto all fours, so wrists directly under shoulders, knees under hips, and just doing one more cat-cow if you like, just to find your center, your neutral position. From here, we're going to breathe in, and then as we exhale, we're going to slide the right arm and left leg forward, and then come back to center. So we're just setting here, making sure that there's no shift through the pelvis. On the next one, we're going to lift all the way up and then floating back down. So exhale straight up, inhale down. Always feel active through that left arm that you're pressing the floor away. We're not dipping into the lower back. Gently hugging the baby towards the spine as we reach. Nearly there. 2 more. Exhale, reach. On the next one, we're going to stay up there and pulse. So from here, we're going to pulse 1, 2, 3, 4, 5, 6, 7, 8. Well done. Coming back to center, changing sides. So just remember we did 4 setting Supermans first. So as we breathe in, so going left arm, right leg, inhale, prepare. And then exhale, we're just sliding, just making sure we're nice and stable through the lower back. Exhale, inhale, float back. 2 more. Just getting ready for the exercise to come. So on the next one, we're going to reach all the way up. Nice and supportive through that right arm, pressing the floor away. Well done. Inhale, float. Exhale, lift. You have 3 more. Remember, on the next one, we're going to stay up there and pulse for 8. Exhale, and then pulse. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Well done. Floating back down. Gently taking that left leg, we're going to step forward. Have your left leg more towards the outer edge of your mat, and we're going to slightly turn the foot out. So from here, we're going to breathe in, zippering up. We're going to exhale, hinge forward for a nice hip flexor stretch, as well as an adductor stretch on the opposite leg. So inhale, coming back, and then exhale, just opening up. Inhale, float. Still important that you don't want to dip through that lower back and just let the belly hang out, or you still want to think nice and active through the core, even though it's a stretch. Just do 2 more here. So just opening up the hips, enjoying that nice stretch. And last one. Well done. We'll take the left leg out to the side, place the arms back down, find your neutral posture. So again, do a couple of curls with the back and find that neutral spine. And we're going to press back like we're going into a child's pose or rest pose for that inner thigh stretch. And then floating back to center. Pressing the floor away as we press back, enjoy that stretch, and then come back to center. Well done. Two more. And then last one. Nice inner thigh stretch there. Well done. Left leg comes down. So gently coming up, right foot to the edges of your mat, turning your foot out, hands on your hips. Belly button to spine as we grow tall through the crown of the head, and then just lunging forward. Good. And then inhale back. may feel a different side to side like me. I definitely feel tighter through that left hip. Well done. So even though it's a stretch, we still want to feel that gentle connection of the lower abdominals, making sure we're not arching into the lower back. One more here. Well done. Coming back, we're going to take the right leg out to the side, placing the hands directly under the shoulders. Again, just finding that neutral spine so we're not swaying into the lower back. Going into our child's pose, so we're going to press the floor away. Feel that inner thigh stretch on that right leg now, and then floating back to center. So going as far as we can, keeping that neutral spine. So you don't want to press back and collapse through the chest. Arms are active. Welcome. Just 2 more. Last one here. Coming back to center. Placing that right foot down now, going into a gentle calf stretch. So just enjoy this stretch. Again, we're still active, so we're not collapsing. We're still doing work through the shoulders, pressing the floor away, and we're still hugging baby towards the spine, making sure our lower back stays in a nice neutral position. Taking a couple of breaths here. And then gently floating the right knee back down, extending that left leg. Energy out through the left heel, long through the crown of the head, pressing the floor away. Enjoy this stretch. One more breath here. Well done. Gently coming down onto your left side. We're going to extend the right leg and just coming up into a side stretch. So we're going to breathe in, and then as we exhale, we're going to come to a side reach, side plank, and then lower back down. So we're going to extend side body stretch, plank, and float. That's 2, you've got 4 more. Side body stretch, plank, and float. Making sure that you're breathing through the movement, you're not holding your breath. Plank and lower, 1 more. And then lowering back down. Gently making your way down onto your side. You can use your supporting hand as a pillow, or you can actually use a pillow again with the belly if you feel like it's dragging towards the ground and you can no longer support it with your muscles. Feel free to either give it a hug or gently pop a pillow underneath your tummy. So from here, we're going to extend the right leg. Place that right arm down just to help stabilize. Imagine that you can slide a piece of paper between yourself and the mat. Breathe in, and then exhale, we're gonna float that top leg up. 1. So nice and stacked through the hips. 2. The back of the head is nice and long. 3. Inhale, lower. 4. 5. Well done. 6. 7, 8, and we're just going to float to hip height, and we'll go for 8 circles. So inhale and then exhale. So you really want to feel like the hip is stirring in the socket. 4, 5, 6, 7, and 8, and reverse. So that left leg, believe it or not, the left knee should be pressing into the floor. 3, my glutes are awake on that right side. 4, 5, 6, 7, and 8. Well done. Floating back down, give it a tap. Even extend that bottom leg, and we'll just go into a nice quad. Oh, I'm gonna have to keep my knee bent. Go into a nice quad stretch on that side. Well done. One more breath here. And gently making your way back up and changing sides. So coming onto the right side. So from here, we're going to breathe in. Exhale, we're going to come into a side body stretch. Find that plank and then floating back down. Side body stretch, plank and float. Well done. 4 more. Side body stretch, plank and float. Again, making sure you're breathing through that movement. You're not holding your breath or bearing down. Well done. Last one. Plank and lower. Well done. Making your way down onto that right side body. From there, we're going to extend the top leg. Imagine that we could slide a piece of paper between your tummy and the floor. Breathing in at the bottom. And then exhale, lifting up through the pelvic floor, gently hugging baby towards spine. Long through the crown of the head. 4, 5, 6, 7, one more. 8, going to hip height, and we're stirring the hip in the socket, doing little circles. Making sure we breathe throughout the movement. 4, 5, 6, nearly there. We're going to reverse. 7, last one. 8, and then just reversing direction. 1, 2, energy out through the heel. 3, 4, right leg pressing into the floor. 6, if I can count. 7, last one. 8, lower back down, give that left side a tap. And going into a gentle quad stretch. So keep that right knee bent just to help give a bit more stability. Feel a stretch down the left thigh. Well done, we're nearly there, home stretch. One more breath. Well done, making your way up. Sitting on your bottom. We're just going to go into your windscreen wipers in sitting. So hand position completely up to you if you want your fingers to face back to open, or if that you don't have the range in your shoulder, you can point towards your tailbone. So whatever feels comfortable, I'm going to open, and then we're just going to exhale, inhale, and then exhale. So just opening up here, it is very easy to just let everything go and let the belly go, but we do still want to think of that gentle lift up and in through the pelvic floor, as well as the wrapping below the belly button. So you gently give baby a hug towards the spine as we exhale, float. Inhale back to center, and then exhale, float. Well done. We'll do 2 more to each side. One more to the right. One more to the left. Well done. Just placing that right foot behind you. I'm just going into a modified pigeon stretch. So from there, just trying to make a 90-degree angle at the knee, and then just leaning forward. So obviously the belly may or may not have enough space, so just working with what you've got. I don't feel very comfortable anymore coming down onto my elbows, so I think about more pivoting off the hips and just reaching forward. And that gives me a nice stretch through the left glutes. Taking a nice full breath here, breathing in and then out. And as you breathe out, you just feel that you gently melt into the stretch just a little bit more, working within what's comfortable for you, making sure you still have enough space for baby. One more breath here. Well done. Gently changing sides, so right leg will come forward. And again, just coming forward to where's comfortable. If you're still able to get down onto your elbows and have enough space for baby, go for it. If not, just think more about reaching forward than collapsing down. So breathing in and then melting into that stretch. Breathing in. Three more breaths here. Melting the shoulder blades down the spine. Last breath here. And then gently floating back up. Well done.